Hello, I am Luana Ferreira Machado and I'm going to present this abstract entitled Morrica's Pituitary Neuroadenolysis for the Treatment of Cancer Pain, whose authors are me, Luana Ferreira Machado, Gabriela Ferreira Kalkman, Thiago Laurenti Gomes, and Tânia Gonzalez Rossi. Introduction. Well, it's known that cancer pain is considered to be virtually untreatable. Thereby, non-conservative approaches such as Morrica's pituitary neuroadenolysis can be an option. Methods. As a method, a systematic review was made using the terms hypophysectomy and cancer pain in the PubMed search tool. In total, 35 articles were identified. However, considering that the inclusion criteria were studies in humans diagnosed with oncological pain who were treated with hypophysectomy in any age group and original studies published in any language, the total of studies included was 8. Results. Well, Morrica's pituitary neuroadenolysis seems to relieve intractable cancer pain by a likely suppressed mechanism of pain transmission in C fibers by means of the cerebrospinal fluid peptides. As for the side effects commonly reported by patients undergoing surgical hypophysectomy, Morrica's pituitary neuroadenolysis, or other types of chemical hypophysectomy, there was the occurrence of headache, temporary diabetes insipidus, hallucinations, and deficit in the left eye's temporal field, and extraocular paresis, the latter being effects reported in only a few cases. Well, it's also known that such visual effects can be permanent or transient, and they are associated with the effects of the alcohol on the optical chiasm. Well, in relation to post-Morrica's pituitary neuroadenolysis complications and post-surgical hypophysectomy complications, meningite and cerebrospinal fluid rhinorrhea were reported. Well, in addition, defects in the visual field and temporary unilateral ophthalmoplegia were also reported after some cases of Morrica's pituitary neuroadenolysis. Well, after surgical hypophysectomy, the mortality rate was 5.6%, while with Morrica's pituitary neuroadenolysis, there were no deaths. Finally, the effectiveness of Morrica's pituitary neuroadenolysis was associated in more than one case with subsequent procedures, in which it can be repeated up to 2 times if the first and the second were not enough. Conclusions. Through this abstract, it was possible to conclude that Morrica's pituitary neuroadenolysis, in comparison with other techniques such as surgical hypophysectomy, can be an alternative for the treatment of cancer pain. This considers the inexistence or low mortality rate of Morrica's pituitary neuroadenolysis. References. Well, here are some references used to develop this abstract. And thank you so much for your attention and for this opportunity.